I think it's as much a reflection of patients and the emphasis that we have in healthcare nowadays as it is economic driving forces or the other things that you suggest. The reality is that as we continue to advance in terms of both knowledge and technological advances, we take better and better care of patients who are sicker and have more complicated disease. And by definition, those individuals need more intensive monitoring, more intensive care, and different types of care that a single physician by themselves may or may not necessarily be able to provide. And so that's, I think, really where interdisciplinary care comes from. I think the other recognition is that as we all grapple with the challenges of improving healthcare outcomes and emphasize patient-centered outcomes-based care, that again provides an opportunity to really leverage the entire healthcare team present in an office practice, present in an ICU, because one person, we all know that one person can only keep 5 or 7 things in their head before you make a mistake. So it's by that team-centered, patient-centered care that we eliminate those errors, we create the decision support tools, and divide all those complex issues into manageable pieces that then we can make sure that we execute effectively and translate into better patient outcomes. I mean, I think it depends very much on the patient population that you're in and the type of facility that you're in, or quite honestly, I mean, it's really a function of the volume of patients, the types of diagnoses that you're taking care of. Certain populations of patients, such as cystic fibrosis patients, for example, really require a very diverse and specialized team to effectively take care of their very complex pathophysiology and the challenges that we face with their management. The same thing is true for pulmonary hypertension patients, critically ill patients in the ICU. The list goes on and on. I think in many ways healthcare is perhaps a little bit behind some other industries out there in terms of defining the right tools, teamwork, and shared models to really fully integrate all the tremendous talents that are present in a healthcare environment. All you had to do was listen to our keynote speaker today, who really, I think, gave a wonderful discussion of how population health can drive outcomes-based interventions, and then how those outcomes-based interventions must be translated in an individual office practice or in a city to really create decision support tools and resources that help to advance patient outcomes, improve patient outcomes with, in his case, with smoking cessation and pneumococcal vaccination. Things that would seem really easy, except they're sometimes really hard.